Santosh has worked uh, with her to get some of the cases and solved for the oral maxillofacial surgeries. So we are say fortunate here with us, Dr. Chitra Chakravarthy, madam. She is a professor and head of the department of oral and maxillofacial surgery at Navodaya Dental College and Hospitals, Raichur, Karnataka. She has been an academician for the past 20 years, say training the undergrads and the postgrad students. And she has authored a textbook of oral maxillofacial surgery, which is its third edition now, and also authored a handbook of dental instruments. And she is the director of a Spark Center for Advanced Dentistry in Hyderabad, where she conducts clinical courses for dental students using newer technologies like 3D printing for surgical skill enhancements. So that's what we can understand. She is already the 3D printing technology, how she is using it for the training the doctor community, and she specializes in maxillofacial trauma, orthodontic surgery, pathetic implant dentistry, and other areas of maxillofacial surgeries. And with her special interest in 3D printing technology for the past 6 years, she has fabricated innovative designs for better surgical practice. She also runs her own 3D printing lab with a team of engineers and fabricates 3D models, surgical guides, and patient specific implants for maxillofacial cases. She is also an international faculty for YEVO and has conducted lectures on various platforms over the past few years. And with the brief introduction of this today's speaker, that is Dr. Chitra Chakravarthy. She is a professor from Oral Maxillofacial Department of Navodaya Dental College Hospitals. So it is a privilege for us to have a speaker here to address the participants of the FDP. So it is over to you, ma'am. So we will make you the presenter now. So you present now.
Thank you so much, Dr. Ravi Kumar and the entire team of NIT Warangal. Special thanks to Dr. Santosh also for having me here actually for the second time. Last time we had a live program and it was really very nice actually to meet everybody over there. So this time I think due to COVID restrictions we are doing it online, which is also great. We are able to connect to a lot of people online nowadays with this platform. So I've been given a really nice topic over here on impalpable facts of medical 3D printing, current status. So today I would be talking about, let us say, when we talk about impalpable facts basically are those facts which we don't think about very much when we are doing 3D printing. We are so focused on what we want as the final result that we don't think about the various steps that go through in getting the final result that we actually want. Okay, so today we'll probably be discussing 5 impalpable facts that I thought of when we talk about medical 3D printing and how I have utilized it in our cases and how it has helped me over time in evolving in this technology as I have been using it in the past few years. So I am a maxillofacial surgeon, so most of the cases that you're going to be seeing over here, which have been used on patients for surgeries in the head and neck region, different types of applications, different types of guides, different use of materials. So let us see how we can improvise our, the surgical cases that we do with the help of medical 3D printing. I'll be very happy to answer questions at the end of the session. So please do keep it ready at that time so we can have a good discussion too. So when we talk about medical 3D printing, still I would think there is a lot for us to learn and lot for us to improve in this particular aspect, and let us get into the depth and see what is there within this particular realm in utilizing it in the medical fraternity. So we have come a long way from where we were initially for, let's say, extraction of tooth, where very crude technologies were used in the past, to now where we talk about artificial intelligence and virtual reality as a way of life in our medical treatments as well. Robotic surgeries and all these things have also come inside. And similarly, 3D printing has now become a very common name. Additive manufacturing, or the use of 3D printing with its various applications in the medical field, has become very commonplace nowadays. And I would like to show how it has really helped us enhance our surgical skills with the use of this technology. Also, I would like to say definitely that our surgical skills are something that we learned during our training period, but with the use of technology, we are able to enhance this skill and make it even better and give a better result for our patients at all times. So we are all aware that the use of medical 3D printing first begins with imaging, whether with a proper CT scan or an MRI, depending on what type of case we are doing and how we utilize, how we want that particular imaging to be used for our patient. So this scan is then segmented, and various softwares are used on this to finally get our 3D model or whatever guide that we are fabricating for our procedure. So before we start off with the actual, the lecture that I'm talking about, let us first understand, is 3D printing really accurate? So because we are going to be using it in all our patients, when we do patient specific guides, the whole idea of 3D printing is because it is customized to each particular patient, and which makes it a very, very unique technology, because all these years we used to make we used to sort of adapt whatever we had to our patient to make it useful to them. So now we have to try and find out, really, is 3D printing as accurate? So we did a small study in our institution where we used cadaveric mandibles, and we tried to find out, with linear measurements, as to how accurate this 3D printing really is when we put it to use in our patient. So we found that it had almost a 97% accuracy, which is really good actually, especially when we want to use it for patient-specific implants, or when we want to use it even for patient-specific guides, because this type of accuracy helps us to improve our surgical procedure when we want to work it on the patient. So this particular study was done with the use of CT scans, and as you can see, the various measurements were overlapped from cadaveric mandible to the virtual model, even to the final 3D model that we have done over here. And we have found that, like I told you, a very good accuracy of 3D printing, which makes it very useful for us to use. Also, this particular technology moves us from not only a visual environment where we are able to see and visualize inside the patient's mouth or inside the patient's jaws, to two-dimensional technology, which gives us just a two-dimensional view, whereas a 3D printing technology gives us a three-dimensional application, not only visual but also a touch sensation, where we are able to hold and feel the model, the exact patient's jaws, and try to understand what we can do to improve, or what we can do to remove the particular pathology that is there inside the jaw. So today we are talking about 5 impalpable facts of medical 3D printing. So I have tried to put together 5 facts that I thought was very important when we are doing any particular case for 3D printing, where we are using this technology in our medical applications. So the 5 facts that I have put together are: first, fact number 1, the right case selection. The second fact, the right scan. The third fact would be the right planning or the right designing. Point number 4 would be the right material, or even the cost effectiveness for our patient. And the fifth fact would be the right utilization of this technology in the right time for our patients. So let us go through each of these particular facts that we are talking about over here and see how it has helped me in my patients here. So let's go on to impalpable fact number 1, the right case selection. Now, although we have a particular technology which can be used with our imagination, we can try and use it for every single patient that comes to us in any different way that we can think about. But there are particular cases where it really helps the patient, and I feel with this technology, the cases that I have done earlier in the conventional way have probably not given us that type of result as we would have wanted it, or it has made it much easier for me with the use of this type of technology. So when we talk about a simple procedure, let me start with something called as endodontics. When we talk about endodontics, it basically means, I'm sure all of us at some point of time would have experienced severe tooth pain due to cavities for which we require root canal treatments. So when we do a root canal treatment, we talk about reaching into the pulp of the tooth, which is shown as this small orange line or streak which is present inside the tooth. You can see how tiny or small it is to access right inside it. Now, with the use of various scans like cone beam computer tomography, we are able to get the scan of individual teeth that we want. We are able to isolate those particular areas that we want to look into in more detail. And with these particular scans, you can see with what detail you are able to visualize into such a small tooth structure, and into that small tooth structure, the small canal that is present, which goes right into the nerve area of the tooth. So we are able to visualize this because of the advancement in the radiological techniques also. We are able to isolate the exact architecture of the pulp of the tooth, which is so amazing actually when you really look at this technology. At the same time, we are able to fabricate a guide with the help of 3D printing technology, which allows us to access this particular root canal without having any deviation from where we want to start. So it is a very simple technology for a very simple procedure, but sometimes it can be very difficult for us to access all these canals or visualize these canals because you can see how minute they are. So with the help of 3D printing technology, we are able to fabricate with the help of software these type of access guides, which actually drill exactly into the area of the tooth which you are looking for, and goes exactly, you can see how these small instruments actually just go into that root canal or the chamber into the tooth that we wanted to go. So I thought this was a really amazing technology. We have used it specifically in those areas which are difficult to access, in those cases where sometimes you're not able to enter exactly into that particular canal. So this is the use of endodontic therapy with the help of 3D printing technology. Now, there are some patients who lose their teeth at a very early age. Okay, so even young patients or even older patients, you have them completely without any teeth at all. So we generally place dental implants for these type of patients and give them a prosthesis on which they are able to chew and eat easily. So for placing of dental implants, sometimes we use what is called a flapless technology, where we don't want to reflect the gum or open up the gum and make it a big surgical procedure. So with the use of 3D printed technology, we are able to fabricate these type of guides with our radiological investigations, that is the use of CBCT. We do a virtual planning of this entire case with the help of intraoral scans as well as CBCTs. We overlap both of them. We try to find out the best places to put the implants, the angulations to place the implants, and then we are finally able to fabricate a guide with which the implants, you can see how neatly the implants will be placed in the exact positions as we have planned virtually. It just goes inside without any incisions, without the use of a blade. We are able to fabricate these guides and put these implants right into the correct positions. So, and the prosthesis is given, you can see how accurate the entire thing works out and how happy our patient is at the end of this procedure. So it is almost bloodless because we do not reflect any gingiva or don't open up the gums. We don't even use a blade. We directly drill right into it. You can see how accurate this entire procedure is. And like I was telling you, because these guides are so accurate, you are able to rehabilitate your patient very painlessly and in a much easier manner compared to what we used to do conventionally. Another important use of 3D printing is what I have seen. Like I said, the case selection is extremely important. This is again another patient in which we have removed one portion of her jaw because she had a large tumor inside her jaw, and we wanted to rehabilitate. So we have placed what is called a fibula graft, or a bone that is taken from the leg and placed into the jaw to reconstruct that part. Now, after she has healed completely, we use dental implants to rehabilitate her fully. And in these cases also, we use these type of guides, which are very patient specific. They give us the exact positions. We don't need to use incisions and open up the flap once again. So we just directly place these implants into the patient's jaw. Similarly, a patient with a small missing tooth, you can see how a very small area of the jaw it requires a lot of accuracy to place that particular implant exactly in that position for us to be able to give the patient exactly what she wants. So with the help of these type of 3D printed guides, in a limited space, we are able to place with high accuracy the exact position for the dental implants and give the patient a very beautiful smile at the end of the procedure. So the use of 3D printed splints. Now in pediatric patients, that is patients who are children, now when we want to do it in the conventional way for these type of patients who have small fractures of their jaw due to some small accidents that they have during their childhood. So these type of patients, usually in the conventional way, if you look at it, you can see that there's a small fracture line that is running inside the lower jaw of this patient. For these patients, we take a CT scan. In the conventional way, I would have had to make impressions with in a very painful manner by putting certain materials inside the patient's mouth and taking the molds and then fabricating these type of splints. But with the help of radiological advances as well as 3D printing, we are able to use this technology with our CT scan to virtually reduce with the help of software to bring the lower jaw into its normal position, get the teeth also into the correct position, and we fabricate this splint which is 3D printed, patient specific, and we are able to transfer this into the patient's mouth exactly during the surgery. It fits perfectly without any need for any trimming or any need for any changes, and this is how our patient has been rehabilitated with the help of placing of these type of cap splints, as we call it. Now, these type of splints will help us get the teeth, not only the teeth, but also the patient's jaw into the perfect position that we wanted, the perfect alignment that we wanted. The virtual surgical planning helps us a lot in these type of patients, especially in small children, because you don't want to give them, they don't have too much of time. First of all, they are very restless if they don't want to undergo too many painful procedures because they will not be cooperative. So in these type of patients, actually, it is extremely useful to use these type of technologies where we are able to do it much faster and much more accurately and give the patient a much better result in these cases. So this is how we have checked the accuracy. The post-operative scans have also been taken where you can see that the alignment of the lower jaw has come out so beautifully, where earlier there used to be a big step in this place because of the fracture. We can see that how we have overlapped the pre-operative, the virtual surgical plan as well as the post-operative scan to see how accurate our splint is, and we have seen that it has been pretty accurate actually to give us the perfect result for our patient. We have also have publications on the same particular case where we have used this type of technology with the help of 3D printing and it has benefited our patient immensely. So this was our impalpable fact number 1, which we spoke about, where a good case selection helps you to give a good result for your patient in those cases where conventional technology probably would have been a little more difficult for you to use in these type of patients. So let us go on to impalpable fact number 2. Okay, so when we talk about this particular fact that I want to talk about, I want to stress on the right scan that is required for each patient. Okay, so based on what type of procedure you want to do for your patient or how much of exposure of the face or whichever part of the body that you're looking for is required, the right type of scan has to be selected. So nowadays, people are veering towards the use of cone beam computer tomography in the head and neck region to a large extent. It is very similar to your CT technology, but because it uses a cone beam for the radiation during the procedure, it has a much lesser radiation exposure and gives you good volumetric data in a 3 dimension. You can see how the entire jaw can be captured, or just one portion of your jaw also can be captured. We can even trace the vital structures like the nerves inside the jaw. We can have a look at every single detail that is present. You can utilize it, like I told you, even for root canal therapy, where we look into the patient's tooth also. So you can see with what clarity we are able to visualize each structure. So now this is a cone beam computer tomography. This when we are looking for very small structures or very particular areas that we are looking for, a cone beam computer tomography gives you very good accuracy in these type of cases. For some cases where you want a wider exposure, cone beam computer tomography nowadays is able to give you a better field of view where we are able to cover the entire head and neck or the entire skull also. A CT scan sometimes gives you a much better clarity. So in some cases where you want to do a little more major procedure on the patient, you might want to switch to the use of a CT scan rather than the use of a CBCT. So CBCTs also gives you, as you can see, the amount of detail inside the jaw. You're able to visualize the length, the breadth of the particular lesion that you're looking at, how much of the bone has actually been destroyed. In this particular case, you're able to visualize the fracture line and see where exactly the fracture line is traversing from the outer to the inner surface. You're able to visualize the structure of the bone exactly. Even certain small cysts and tumors that are present inside the jaw can be seen with high clarity with the use of this type of radiological techniques. So of course, we know that CBCT has got a lot of benefits. The first one being a very low radiation dose, which is very beneficial to our patient. Less time, increased accuracy, easy visibility of very small structures and details. There's no need to magnify because you're able to visualize it. There's no magnification in a CBCT as such. There's interactive display modes will be there where you can see different vital structures. You can see the bone structure with more clarity or the soft tissue structures with more clarity. It is also more cost effective for the patient, and we are able to take multiple scans in short periods of time because the radiation exposure is not much for the patients. Now, when we look at certain cases, like let us say facial deformities, where a patient has, let's say, a deformity of the nose or deformity of the particular area of the jaw. In earlier times, when we talk about, let's say, during historical procedures, these type of patients would be masked with different things which were clipped on to their faces to mask the deformity. Like in this patient, if he did not have a nose or nasal structure was completely destroyed due to some reason, they would put on an artificially fabricated nose with the help of the glasses and would be held on to the patient's face. Nowadays, we don't want to do these type of things. We are able to reconstruct much better, basically because of better access to radiology, better access to different types of scanning techniques. So if you look at this, we have a different specific technology called Dolphin 3D scans, in which we are able to get how beautifully you can see how patient's scan is acquired. The entire hard tissue structure is visible so beautifully. So in these type of facial deformities, we are able to do this with the help of CT scans. So we need to decide whether our patient requires a CBCT, whether our patient requires an MRI, or whether our patient requires a CT based on the case that we are analyzing. So this CT scan is very useful to analyze the hard tissues of the patient. In patients with facial deformities, we need not only the hard tissue, but also the soft tissue envelope is very important, because when I move the hard tissues into a particular area, I want the overlap of the soft tissues also to move in that particular way. So it becomes predictable for me with the help of these type of softwares and these scanning techniques for us to understand how we are able to give that result to the patient even before we do the surgery. So with our virtual surgical planning itself, we are able to give this to our patients. So let us see how this particular technology helps us. So now we have got the hard tissue structure. We adjust the segmentation, we get the best clarity that we want in this particular case. After this is done, we want to get a soft tissue overlap of the patient. So we take an MRI of this particular patient, and then we overlap the MRI as well as the CT scan, that is the hard tissue and the soft tissue structures together. We put them all together, we overlap them exactly in the right position, we fix the head position in the center, and then we overlap the soft tissues. You can see how the soft tissue outline has come exactly onto this. We can work this in different angulations, different directions, depending on what facial deformity we are looking at in this particular patient. Now, this particular technology also helps us even in getting the skin tone or the color of the skin as well. We are able to understand with a facial photograph, we can select what type of skin tone also we want for the patient, and you can see how beautifully the 3D model looks in the end. This is the virtual 3D model. We are able to get exactly the patient. It appears as though we are seeing the patient right in front of us. Virtually, we are able to do the particular procedure that we want on these patients as well. Now, after all this is done, we can even look at the intraoral scan where we can see the patient's teeth. The teeth also can be overlapped into this particular CT scan. I'm trying to highlight to you how important it is to understand all the different types of scans that are available and what is best for our patient and how we need to utilize this radiological technology to give the best for our patient. So in this particular case, I'm showing you how a CT scan has been used to get the hard tissue structure. The MRI has been used to get the soft tissue envelope of the patient.
Excuse me, ma'am, your voice is not audible.
Hello, madam.
కాల్ చేయండి అయితే ఒకసారి మేడంకి.
సార్
అయితే ఆవిడని వీడియో ఆఫ్ చేయమనండి. బ్యాండ్ విడ్త్ అనే ఇష్యూనా మరి?
I think you're not able to hear me.
गाड़ी की चाबी ला बोल तो क्या कर रही थी देखने ला बोले किसको ला बोले फिर आने ना दे देखूंगा.
Can I just restart the meeting? Actually, I'm not able to understand where to start from.
ఓకే మేడం.
Are you able to hear me now?
మేడం.
Okay, so I'll just continue. Thank you. Are you able to see my screen as well?
Yes.
Okay. Right. So let's go on to impalpable fact number 3. Now, so we have seen how particular case selections are very important in how you would want to go about your procedure. We have seen how the right type of scan is able to help you do your procedure much better. Now let us go on to the right planning and the right design for your particular patient that you want to do, whichever procedure that you want to do. So when we talk about different procedures that we have used, the different planning techniques, there are various softwares that are available. Now we talk about, let's say, patient dentures. Okay, so normally in a conventional way, if I was to make patient dentures, the accuracy depends a lot on how we do our manual impressions, how we make the molds, and how the lab fabricates these particular dentures. Now with the use of 3D printing technology, you are able to get a much more accurate denture. You're also able to use different types of materials. You are also able to get a much better adaptation of this particular denture to the patient's gums when you fabricate this. The other very important thing that we need to understand is the time taken. Usually we would call the patient for at least 4 or 5 sittings when we do a conventional denture. But in case of a denture, 3D printed denture, we are able to give it to them much faster. A single scan will be sufficient from the doctor, the dentist who is fabricating this. You want the final mold, you want just some information of what is the lip line like, how is the midline, where do you want the teeth to be exactly, what is the shade or the shape of the teeth that you want. Once all this is decided, the scan of the cast is done. We make a mold, we pour a cast, and this particular cast is scanned, or we can even use an intraoral scanner for us to get a very accurate measurement of the entire jaw. Once we get this, with the use of software, we are able to fabricate this particular denture virtually first, get the exact position of the teeth. You can see how nicely the teeth are sitting one inside the other, exactly how we want it inside the patient's jaw. Then we are able to fabricate this entire, the tooth section separately, the denture base section separately, and then after the post-processing is done, and we are able to fuse the teeth as well as the denture base together to give a very beautiful denture for our patient. We also use this type of technology in different other dental procedures, like when you want to replace a single tooth or multiple teeth with the help of caps or crowns, as we call it. Different materials are used. We use porcelain fused to metal crowns. We can use either cast metal or 3D printed metal, and the accuracy of these type of things is very good. And this is all possible because we are able to do a very good planning with the help of different varieties of softwares which are available nowadays. We also use a very upcoming field nowadays, the use of orthodontic aligners. You must have seen so many advertisements of these type of procedures where patients have small dental malocclusions where there are spacings or overlapping of the teeth, and you don't want to go through the conventional procedure of putting braces or brackets on top of your teeth like with metal or with ceramic. In these cases, we use what are called dental aligners. These are not only more aesthetic, they are also very effective. But of course, again, case selection is very important. Which patient is actually suitable for these type of treatments? So we are able to do, first we start with an intraoral scan. After the intraoral scan, you have an entire planning process. So here we have the software that really is useful, which helps you to analyze the patient's teeth structure, the jaw structure, and how you want to move the teeth and in which direction you want to move the teeth. And finally, the models are printed. You have models printed at different stages of the treatment, and then with thermoform you are able to fabricate these particular aligners, which are made in acrylic, and then you finish each of them, and the patient is delivered this entire set of aligners, which they keep replacing every 15 days, with which they are able to get a much better dental alignment by the end of the procedure. I'm trying to highlight to you in this particular point how different planning softwares have helped us in 3D printing nowadays to give a much easier or a better result for our patients. So dental implant guides also, as I showed you earlier, where you want to replace either single missing tooth or multiple missing teeth with the help of the dental implants. In those cases also, a good scan as well as an impression, and finally the virtual software will give you the position of the tooth exactly, and based on the position of the tooth we decide where exactly the implant is going to come inside the bone. and this gives you a much better accuracy. We finally print that type of guide using an SLA printer, and this guide is placed inside the patient's mouth, and you can actually blindly go right through the guide and get exactly the correct position of your implant. So some of the cases that we do where we have, since I'm a maxillofacial surgeon, we see a lot of what is called fractures or trauma cases, where due to accidents patients break their lower or upper jaw or some part of their jaw. In those cases, first we used to use 2D scans like this, in which you only get a two-dimensional imaging. Even though it is taken in different angulations, you can see how the patient's teeth alignment is completely disrupted because the jaw is broken inside. Nowadays, we use a CT scan. You can see how much the displacement of the bone is in this case. We even get a three-dimensional reconstruction of this 3D scans. Of our CT scan, and you can visualize exactly which muscle is pulling which part of the bone in which direction, so that I can actually bring it back into normal position much more easily in our patient. So with a three-dimensional view, you can actually visualize the jaw in all different angulations. You are able to turn the jaw in different angulations. You're able to move it around to see exactly where the fracture is. You're able to virtually reduce this and bring it back into normal occlusion also. So you are able to see, sorry, I don't know why I'm not able to visualize these pictures. Okay. Just give me a minute, please. I'm just trying to get you those pictures which I wanted to show you.
Okay, ma'am. Okay.
Are you able to visualize this now?
Yes, ma'am. Yes.
Okay, so after visualizing this, you're able to see this in all different directions. You can move the scan, the 3D image that you have got, your STL image, you can move it in different directions. You're able to visualize the inner aspect, the outer aspect. And after all that, the most important part is the alignment of the bone, which we virtually do. And this also you're able to visualize in different directions to be able to give the best result for your patient. You can see with how much detail we are even able to approximate the teeth or bring the teeth together in exactly the position that you want to, in the final position inside the patient's mouth, which is extremely important for us actually as dentists, because the dental occlusion is something that we really want the patient to have the perfect dental occlusion by the end of the procedure. So these are how your softwares help you in getting a perfect dental alignment, the perfect jaw alignment also for the patient. And with this, we are able to fabricate what is called an occlusal guidance splint. So we fabricate a splint which has the impressions of both the upper and lower teeth. And this we are able to put inside the patient's mouth during the procedure. The model is also fabricated, and on this model we even put the plates that we want. We pre-adapt these plates so that we are able to save a lot of time during our surgery, and the plates are exactly placed inside the patient's mouth. We also fabricate guides to hold the bone in position. You saw how the alignment was completely gone. Once you want to bring the alignment into position with the help of these type of guides, we put these guides inside the patient's mouth during the surgery, and we fabricate with the plates that we have already pre-adapted. We put it into the patient's mouth. We put the guide which helps to bring the teeth also into proper position. So this is the use of different types of surgical splints that is used for our patients, which gives us a much better result during the entire surgery. I'll just go back to the previous PowerPoint that I was on earlier. So you can see how when we do these post-operatively, we are able to get a much better result in these type of patients. So again, with virtual surgical planning, we are able to give, sometimes we do what is called a distraction procedure, where we put a small distractor inside the patient's jaw to move their jaw forward. So in these cases also, virtual surgical planning helps us a lot in understanding how much we can move the jaw forward. We can fabricate different types of guides. As you can see, these are the appliances that we put inside the patient's jaw, and we can actually move it on the patient's model itself to see how accurate our result is going to be in the end. Virtual surgical planning also helps in case of, let's say, large mandibular tumors or large tumors inside the jaw, where we are able to understand how large the tumor is. We can even adapt a plate or a reconstruction device on these patients on the patient's model before we place it inside the patient's mouth. So these were three facts that we discussed till now. The fourth fact that I want to discuss is the right type of material that you want to choose for your particular case. So if you want to use the correct material, now depending on the type of patient that you're using or type of procedure that you want to do for your patient, whether you're fabricating a guide, whether you're fabricating a patient-specific implant, or whether you're fabricating just a model for use in the patients, all these things will have different materials. We are now very lucky to have so many different types of materials that are available to us, with which we are able to give whatever best we can for our patient. So in these cases, let us think about a particular condition known as temporomandibular joint ankylosis. So this is a condition in which the patient's jaw, actually the joint completely fuses, and it does not allow the patient's jaw to grow. So you can see that this patient has got a facial asymmetry, where one side of her chin has moved to a side like this because one side of her jaw has not grown at all. So when you look at the CT scans, you're able to appreciate that the jaw is completely gone to one side because of the lack of growth of that joint. So in these particular cases, the use of FDM material or even ABS material is very useful for us to plan our surgery. We are able to fabricate these models. These models will help us not only to show our patient that there is a problem here, we even use it as educational models or even for what is called as mock surgery. So in these type of models, we actually do the surgery completely. We move the jaw to the position that we want it finally to give the patient a much better midline, and then we even adapt the plates that we want to place during our surgical procedure, and you can see that we are able to give a much more accurate result. This is the pre-operative view of the patient, where you can see that the chin is completely deviated to a side, whereas after the surgery, and the 3D printing has helped us in giving us a much better facial appearance with the chin coming back to the center. And this is another patient in which the jaw has not grown at all, in which both the joints are completely fused. You can see that the lower jaw does not grow. The patient does not have the capability to open her mouth. She cannot open her mouth at all. Less than 1 centimeter she can open her mouth, which is very difficult for these type of patients. So with the scans, we are able to detect where exactly the problem is. We can see how much of the joint has actually fused with the bone. And with this, even with a 3D reconstruction with the STL images, we are able to do a much better treatment plan for our patients. Here also in these cases, the FDM models really help us to understand, to even measure, to see the thickness of the bone, to see how much our drill needs to go inside the bone when we are doing the surgical procedure. The virtual surgical planning, of course, helps us a lot in deciding where exactly the pathology lies. And in these cases, we have used actually what is known as a flexible FDM material, in which we have, this is a very small surgical area where we open up a very small surgical site in front of the ear. And over there, this kind of flexible material actually goes in very nicely and is able to sit exactly in the place where we want it to, and the bone cutting is done much more easily. So the patient, as you can see earlier, they used to open their mouth only up to about less than a centimeter. The patient is able to open their mouth more than almost up to 4 centimeters actually. Which has given a very good result. So not only do we want to improve the mouth opening in these patients, we also want to improve the appearance of their jaw. And in these cases also, FDM really helps in these type of mock surgeries, where we are able to place the appliances on this exactly as we would have placed it in the patient. To assess how much of the jaw needs to be moved forward or backward, to fabricate different types of guides. In these cases, we even use an SLA material also. And this is how we are able to improve the patient's appearance. You can see she had a very small jaw, and how in the profile it has improved so much now. The patient is much more happier. She has a much more normal looking appearance in her post-operative view. In a procedure called orthognathic surgery, where we want to adjust not only the patient's teeth but also the patient's jaws. In these type of procedures, symmetry, perfection and precision are something that we really look into, because this is something that is very important. This is a cosmetic procedure, and the patient wants the best for best result that we are able to give them. So in this case, when we do the traditional orthognathic or a conventional procedures, it depends a lot on the clinician's judgment of the patient, the experience of the surgeon. So for a novice surgeon, giving a perfect symmetrical appearance to the patient sometimes becomes a little difficult, because you're not able to judge probably where exactly the problem is, and two-dimensional visualization also does not allow you to give a perfect result. So in traditional orthognathic surgeries, we used to take molds of the patient. We used to take different appliances for us to get the exact position of the jaws and how the teeth are coming together. We used to fabricate casts and put them together on articulators, on which we are able to try and understand what is the position. You can see all these are very arbitrary. It does not give you the perfect example of how the patient exactly is. But with the help of virtual surgical planning, we are now able to, with the help of CT scans also, do a virtual surgical plan exactly how the patient's jaw is, to get the exact position of the final position of the jaw, where you want to move the jaw to give a good result for your patient. And with that, with the help of SLA material, I'm trying to show you the use of different types of materials. After a virtual surgical planning is done, the occlusion, that is the way in which the teeth are sitting together, we fabricate with the help of SLA, we fabricate this particular splint, which helps us to guide the teeth into position during our surgery. So this is how we have changed from traditional procedures to how we are doing orthognathic surgery nowadays with the help of 3D printing technology. It is possible with the use, as I showed you, for mock surgeries on FDM materials, and we also have used SLA material for fabrication of different types of splints. Orthognathic surgery, they say there are different publications which tell you that with the help of 3D printing technology, it has increased the aesthetic results. It gives you the optimal functional as well as aesthetic results, improved patient satisfaction also, and helps us to translate whatever we have done virtually into the patient during the surgical part. So a small procedure like a genioplasty, I will show you what that is, where we just do a small procedure on the chin from within the patient's mouth, where we have some patients have a very small chin and you want to move it forward to improve the appearance of these type of patients. You can have tooth supported guides or bone supported guides. You can have it in different materials which are used. I will show you that. We can actually make it very cost effective for our patients also. So one very important point that I would like to highlight is many people don't want to use 3D printing technology, especially the older practitioners, because they feel it is very expensive and it is not cost effective for our patients. And many patients also cannot afford these type of technologies for their surgeries. So I have tried to use different types of materials which makes this type of technology much more accessible to even those patients who are not very affordable. So with the help of different types of surgical guides, so if you look at this particular patient, even in her normal rest position, the entire teeth are visible, giving it an unaesthetic appearance. The center part of the upper jaw is much longer or elongated. So in these patients, we want to do a surgical procedure whereby we are able to give her a much more pleasing aesthetic appearance. We can see that in this case, her chin is very retruded or very much placed backwards. So with the help of CT scans, we create these type of STL images, and then we decide on what type of surgery we want to do. In this particular case, we wanted to intrude the upper jaw because the central portion of her face was very long, and we wanted to intrude it or push it inside with the help of surgery, so that the teeth show that is there when the patient smiles is much lesser. So after the surgical planning is done, with the help of SLA, these are biocompatible materials, so we are able to place it inside the patient's mouth during the surgery. This SLA material is used to fabricate this type of guide designs. You can see it is almost transparent actually, but we place it inside the patient's mouth. It gives you a very, very accurate cut. You can see almost like as though I have placed a scale and you have drawn lines actually inside the patient's jaw and the bone. It gives you a very, very beautiful, accurate cut. Without the help of these guides, the accuracy of these cuts is very much minimized. Now, with the help of these guides, we are able to fabricate even the models in FDM. We already adapt the plates onto that, and the same plate is used inside the patient's jaw during the surgery. This is a small genioplasty procedure where I told you the chin, we cut the chin and move it forward or backward depending on the requirement of the patient. So these are the this is the STL design of the final guide, and with the help of SLA printing, we are able to fabricate these type of guides for our patient. We place it inside the patient's mouth, and this it is almost like drawing a line with the help of a scale. We don't need to think much about the accuracy because it comes out very perfectly. The patient, we are able to give a very good result for our patient. You can see how the tooth show has reduced, how the chin has come forward in this patient, and how 3D printing technology has helped us to get to this level of accuracy for helping our patients. So this is the post-operative CT scan, and as I told you, in all our cases, to see how accurate our 3D printing technology was, we take a post-operative scan and we overlap it with our pre-operative virtual planning to make sure that we have achieved what we wanted for our patient. Similarly, like I told you, some patients are unaffordable and cannot afford the type of guides that we do with the use of this type of higher technology. In these type of patients, we have tried to use little inexpensive type of guides with the help of a technology that has been there for a long time in dentistry, which is called investment casting. As engineers, I'm sure you are all very familiar with this procedure, and I don't need to explain too much to you. In this patient also, we had to cut a part of their jaw joint as well as move a part of their chin to give a good facial symmetry for our patients. So we used investment casting, which we normally use to fabricate caps and crowns for our patient, which for dental treatments. Similar to that, we have fabricated the design, the virtual design that we did in a castable resin. This resin was then cast in a furnace, and we have used cobalt chrome material and fabricated these type of guides, which is very, very inexpensive for our patient compared to an SLA technology, which would have been more expensive for our patient. These type of guides, large guides which we need to use for patients, can be also fabricated with another novel material like investment casting, where we use cobalt chrome, which has been tried and tested. We have used it in patients' mouths for so many years. It is very rigid. It is almost as good as titanium. I would have probably used titanium if it was a much more affordable patient. But since the patient is not able to afford that type of technology, we are using a much more inexpensive material in these type of cases. And so our patient came with a very reduced mouth opening, and you can see how the facial symmetry also is disrupted. You can see that her chin is very retruded, and the facial aesthetics is compromised. The CT scan also shows you the same thing. And we fabricated these type of virtual guides. These guides were then made with a castable resin with 3D printing technology, and then after these were printed, we transferred them into a mold, a silica mold, which was then cast in a furnace, and with that we are able to get a beautiful finish also for our guides. Now these guides were then used inside the patient after sterilization. Because they are metal, I can sterilize them as well. I am not worried about the contamination in these cases, and then I got a much better result for our patient. You can see how the mouth opening has improved. You can see how the profile of the patient also improves, because her lower jaw has come forward very nicely. The symmetry of the patient, as you can see, the chin deviation which was there earlier has now come back to the midline. Investment casting we have also used for many different patients, where we have used it to do small genioplasty guides. We can even fabricate the guides much more thinner. We don't need to make it very thick, because they are made of metal and they will be much more rigid. Another recent case that we have done, where we have used patient-specific implants. Now, patient-specific implants in these, sorry. Give me a minute, please. I'm trying to get you those pictures. I don't know why they have not come into my PowerPoint. Okay, so patient-specific implants. Now, this was again another patient who was not able to afford titanium patient-specific implant. So, in these cases, we have used again investment casting, where you can see this patient had a large tumor in the lower jaw, which needed to be removed. We fabricated cutting guides, we fabricated a repositioning guide, and we also fabricated this particular patient-specific implant in the patient with the help of cast metal technology, with the use of medical grade stainless steel, which was fabricated without any contamination, which was also sterilized before we placed it into the patient's mouth. You can see how accurately it fits into the patient's mouth, right exactly in the place where we want it. We also have used different types of educational models. For with the help of FDM material, we have used in different varieties of procedures. We know how students don't want to learn in the traditional way nowadays. They are so used to different various different touch and feel methods. They want to be able to feel or see it in front of them for them to get a better understanding. So how technology has come into education, into the educational field. We're able to do computer assisted learning with the help of VR, with the help of artificial intelligence. We are able to simulate different types of procedures. In the conventional methods, we would use different types of biological specimens to teach our patients, or cadaveric dissections also were done, or we used to have a lot of table discussions in the earlier times. Classroom teaching, of course, is still there, but it is less effective for our students. And of course, textbooks can almost put people to sleep while we are using these huge textbooks to try and understand different things. Educating our students with the help of biological specimens has become outdated nowadays because we are able to simulate different types of models actually, which give you a much better understanding. So these are some 3D printed models that I fabricated for my students, where we want to teach them how to extract a tooth from a patient's mouth. So we fabricate this model. We even place natural teeth inside this. We cover the entire 3D printed model with the help of silicone rubber to make it look exactly like how it would be in a patient, how the gums would look in pink color, silicone rubber we have used. And this is how the students are able to first do it on the models and first understand how it can be done on the models and then use it on the patient. So we demonstrate to them, we even allow them to do it. We are able to use multiple models because it is not very expensive. We fabricate these type of different models. We use these models even for table discussions because it is much more easier for them to understand when they hold that particular patient's model in their hand. It enhances the skill. You can see how different 3D printed models have been used. We use the exact same instruments like we would use inside the patient's mouth and ask them to simulate that entire surgical procedure in a model for them to first understand how it is to be done. We even use these different models, FDM models, for doing what is called mock surgeries. Our postgraduate students are able to perform this procedure on this model to get a better idea of how it is going to be inside the patient's mouth. We allow them to even adapt the plates. We give them a training on how this can be done to save time during our surgery. We conduct different workshops with the help of these different types of FDM models. We show our students how it can be done, how different applications can be made, or different appliances can be fixed inside the patient's jaws as well. So the soft tissue contour also can be given to make it look more realistic. And we use, like I told you, a silicone rubber to simulate the soft tissue contour. And this gives a very, very realistic appearance to this model actually. So although technology will not replace great teachers, but technology in the hands of a great teacher can actually be very transformational. I thought this quote was very apt in this particular case. Let's go back again to where we were talking about the different impalpable facts over there, different educational models that we spoke about. So I want to come to a very important fact that we spoke about recently, that is impalpable fact number 5, the right utilization of 3D printing technology in the right time. So what I mean by the right time is the use of 3D printing technology during this pandemic has been revolutionary actually. During this pandemic, we have used 3D printing technology in so many different ways, not just for our maxillofacial procedures, but even starting from small things like the RT-PCR test, the swab that is made with the help of 3D printing technology. We have fabricated different types of masks or facial shields that are very useful to doctors as well as to the lay public also. We have fabricated different respirators, even small stands or small things to open door handles so that you are not contaminating the door handle every time you touch it. Even small things, as you can see, people have been very innovative. Even to use sanitizers, they have made a small 3D printing stand which can hold our sanitizer in place. So with this, we can even see how in our particular field, actually, 3D printing technology has been very, very useful. Especially, you must have heard so many cases of mucormycosis or fungal infections in which almost the entire upper jaw of the patient had to be removed in so many patients all over India due to post-COVID effects in the patients, where the entire upper jaw was completely removed because the fungal infection was spreading so rapidly in their jaws. So many patients we have used and we have surgically removed the upper jaw completely. Now all these patients in which we have removed those jaws have to be rehabilitated. They have to come back to the society with a normal appearing upper jaw. So in all these patients, we are using 3D printing technology to give them the best patient-specific implants that we can, or even fabricating different guides for placing dental implants in these type of patients. As you can see in this particular case, the entire upper jaw of the patient has been removed due to the mucormycosis. And in these cases, with the help of a good CT scan, we are able to fabricate, with the help of good software also, these type of patient specific implants on which we are able to fabricate these particular things in titanium, which is then fixed onto the remaining part of the patient's jaw. This is then attached to this kind of a bar like attachment onto which the teeth are placed, and you can see how we are able to give them much better appearance. These patients usually have a lot of psychological trauma, because even young patients, sometimes we have removed the entire upper jaw because of due to the effect of effect of COVID, where a fungal infection has set in and we had to remove the upper jaw completely. So in all these cases, we are now have come to the stage where we are rehabilitating these patients. We are giving them, all these patients literally have been waiting for almost 6 months to come to this stage where we are able to give them a much better appearance of their upper jaw, and they are able to come out into the society normally. So we talk about what is called, and I think this is one of the very, very important fact of 3D printing, where the utilization in the right time has really, really helped us, especially in these mucormycosis cases during this pandemic. It has helped our patients to a large extent to give us whatever best we can do for our patients with the use of this technology. I always talk about an unattainable triangle of 3D printing, where the speed, that is the speed with which we are able to fabricate the prosthesis or whatever we are fabricating, the price, as well as the quality, depending on the material that we are using. This is usually an unattainable triangle, and we are trying to find the best way media for this to give the best results to our patients. So like I tell all my students also, limitations only live in our minds. We have been doing conventional surgeries now. I have been operating for more than 20 years now. But with this technology coming in, we have tried to incorporate the use of this technology in all our patients in whichever way it is possible, to help them to improve, to help us to give better results for the patients and get better outcomes out of our surgeries. So limitations only live in our minds. If we use our imaginations, we are able to get much better possibilities for our patients, and the possibilities are actually limitless. So thank you very much for your very patient hearing. I will be very happy to answer questions. Are you able to hear me? Dr. Ravi Kumar, I would be happy to have any questions if there are any in this session, please.
Participants, any queries? Any of you are having any doubts or queries, please unmute yourself and ask the queries, or you can put it in the chat box also. Thank you, madam, for giving a excellent lecture on this. Your expertise in this impalpable facts in the medical 3D printing with the current status, and what is the so many case studies which you are worked with along with NIT Warangal was given an immense pleasure and a lot of experience given to the participants, those who are working in this medical 3D printing and all. And participants having some queries in the chat box, madam. Can I read, madam?
Yes, please.
Yeah, what are the properties to be considered while selecting the material for implants and mouth jars, madam?
Okay, so yeah, it is very important for us, like I told you, based on the case that we are doing. Now, if you want to fabricate, let us say, a cutting guide. Now, if I am fabricating a cutting guide, the material should be rigid, first of all. It should not get cut along with my drill when I'm using a drill inside the patient's jaw. So in these cases, metal guides will be very useful. In some cases where, especially when we are placing, let us say, dental implants, or you want transparency, you want to visualize the underlying structure as well. In these cases, SLA material is very useful. Depending on the type of case that you're going to do or the type of application that you're putting, you will choose the different materials. So whether it can be metal when you want rigidity, whether you want sterilizability, you want it to be able to sterilize it before putting it inside the patient's mouth. Especially for patient specific implants, you will think about use of metals because you want it to have strength. At the same time, you want it to be light also, and you also want it to be without any contamination because you're putting it inside the patient's mouth. So you have to consider what case you are doing or how you want to help your patient with the use of this technology, and based on that you decide on the material as well.
Thank you, madam. Yeah. Any other queries from the participants? Yeah, if there are no queries, we'll conclude the session. Yeah, thank you, madam. I think there is one more query came, madam. Is there any tests are required to use the material?
Definitely. Thank you, Dr. Alim Pasha. So most of the materials, especially SLA materials, you have some biocompatible materials which are already available. Now, those have already been tested and they are provided to us. So these type of materials we are directly able to use inside the patients because they are already biocompatible and do not cause any reaction in the patient. Now, if you want to use, let's say, patient-specific implants, definitely it is required. Now, titanium is what we use most commonly for patient-specific implants. Titanium is already an inert material. It has been tried and tested in patients, but it is important for us to understand whether the way in which we fabricate that particular patient-specific implant, it has to be fabricated in an environment where there is no contamination. It should not be fabricated along with various other things at the same time also. Tests as such, we do actually nowadays why during the fabrication itself to understand the strength of the material, the strength of the virtual design that you have done. We do finite element analysis on that patient specific implant that we do. And that finite element analysis allows you to understand whether when we put a certain amount of let's say a force on that particular patient specific implant, whether the implant is able to withstand that force or not in the long run. If there are some areas of weakness that we are able to see in the finite element analysis, in those cases we go ahead and we add some more material to your virtual design, and we again expose that virtual design to a finite element analysis also to get the best design for your patient. So that is one particular test that I would definitely recommend that should be done, especially when you are fabricating patient specific implants. Because the jaw forces are quite a lot, and if your implant is not able to withstand, even if you make the most beautiful design and put it inside the patient's mouth, if the implant is not able to withstand that force, then it is a problem. So finite element analysis definitely will be required when you are doing your virtual planning. At the end of the procedure, or once the thing is fabricated, let's say the implant is fabricated, we can check for the sterilization. We actually sterilize it and make sure that it is completely free of contamination before we place it inside the patient's mouth. Which material is mostly preferred, zirconium or titanium for implant of teeth? Okay. So most implants, dental implants, are actually fabricated with titanium. Zirconium has also been used. In fact, a lot of people use zirconium, especially because it is very let's say aesthetically pleasing because it is the color of the material as such. The strength is almost the same. So cost effectively, I think titanium will be a little more cost effective when compared to zirconia when you're talking about teeth implants. That was for answering
Hello.
Dr. Syed Mustafa Ali's question.
Yeah, yes, sir.
Can I talk, sir? Manjay, sir?
Yeah, please, sir. Please go ahead, sir.
Madam. Madam, myself, Dr. Shiva from Narsopeta Engineering College, Head of Mechanical Engineering Department. So, first of all, we are very much thankful to you, Madam, for an impressive and very valuable talk.
Thank you so much,
So,
sir.
being an engineering faculty, now we are in the tension. Doctors also knowing many things. You people are competition to engineering field
Sir,
because
we
you are
cannot
talking
work
about
without
finite
you, sir.
element. No, you talking, you are fully confident about finite element methods. You are talking about materials. We teach normally to the students, being a mechanical students, we teach them, we teach materials, properties, characteristics. But I am fortunate, I mean, surprised. Such a doctor is speaking a complete picture about the materials, and I have thoroughly followed the session, madam. Very interesting, madam. First of
Thank you
all,
so
thank
much,
you
sir.
for your session, madam. I have one or two small queries, madam.
Yes.
Because you are using 3D printing technology, how about the involvement of the engineering academicians or maybe any research institutions you are involving, madam, or you have your own laboratories and you people you have a dedicated team they will be working? I mean, how this research you people are doing, madam?
Sir, actually, when I started off with 3D printing, really speaking, my brother himself is a mechanical engineer, sir. So with his
Oh,
interest, actually, I started with 3D printing. That is the beginning of my journey into this particular field. Once I started
okay.
understanding this technology, actually, I found that there are a lot of because it is patient specific, it is very, very useful for our patients actually. I definitely work with engineers in close contact with engineers, sir. I cannot do the entire work by myself, which is very difficult for me also because I'm more focused on the patient. So from my side, actually, I decide what I want to give for my patient. What I find there is a certain, let's say, a communicational difference between an engineer and a doctor because we are thinking about the patient, you are thinking about the material. And when I work with the engineers, actually, I take some time to actually train those people into what is required for the medical application. Because I see that sometimes, obviously, because you are not trained in the medical aspect and your expertise is on the material and on the technology. So we have to bridge this gap, sir. It is very, very important actually. So I actually teach them a part of the anatomy. They teach me a little bit about the limitations of the software. And then we sort of come to a common point where we are able to make this thing together. I have my own 3D printing lab, sir. I work with 2 or 3 engineers also. And I take their help. I know a little bit about software over these years. I have also learned a little bit, which I am able to design some things on my own also, which I think is very important from our point of view because as doctors, we don't understand the limitations, whether of the material or the technology also. We keep thinking that, yes, this is to be done and this can be done very easily. But there are some things which are actually a lot of limitations in the software, which we are not able to understand. So I think close communication with the engineer and the doctor is very, very important. So if you want to make like a complete 3D printing lab, it is not possible without the presence of doctors as well as engineers, both of them who are familiar with each other's fields. I think this is a very, very important combination to have a successful surgical procedure, sir.
Yeah. Thank you, madam. Because why I'm asking, madam, we are in central part of Andhra Pradesh,
Yes,
and here this is the hub for the medical, facilities. So now I'm thinking we have the expertise in 3D printing. So because I want to know whether you are communicating with engineers or you have your own. So I understand that you have a people you are helping for this kind of thing. So
yes, sir.
definitely we will approach our nearby hospitals and
Yes,
let
sir.
us also we have a interaction with them and we'll also involve. Thank you, madam. Thank
Thank
you
you,
for
sir.
your
I'll be very
valuable
happy to help
and
you out, sir. If there's any cases, I would definitely be available to help you, sir, at any time. because research is definitely area of interest.
Thank you, madam.
Yeah,
Thank
yeah.
you
Thank you.
for
Thank you.
your valuable answers. Yeah, any other queries from the participants? Yeah, if there are no queries, we'll conclude the session. Thank you, madam, once again, on behalf of all the coordinators of this FTP program and as well as from the Department of Mechanical Engineering in IIT Warangal. And thank you for your valuable time for sharing your expertise in this FDP program, madam, with your busy schedules. Thank you very much, madam.
Thank you very much, Manjay sir. Thank you, sir, very much, Dr. Ravi Kumar. Thank you so much for this opportunity. Hopefully next year we should meet in person then.
Yes, madam. We planned this program for offline, but due to COVID situation, the AICT has sanctioned only the online program, madam. Thank you very much.
I understand.
Yeah.
Yeah.
Hope
Thank
we'll
you, sir.
meet in the next year, madam. Thank you very much.
Sure, sir. Thank you very much.
Thank you.
Thank you, madam. Thank you.
Thank you. Thank you, sir.